So fibroids are benign growth of the uterus. They are non-cancerous growths of the uterus. As you can see, they are just everywhere. Up till this moment, we have not been able to elucidate the cause of fibroid. There could be some association, nulliparity, meaning that, okay, women who have not been pregnant before then to have more fibroid than those who have been pregnant. Women of black descendants tend to have more fibroid compared to their Asian counterpart, for instance. So we haven't quite found any relationship with diet, and so we don't think this is related to diet. But we know again that estrogen is one hormone that increases or encourages the growth of fibroids. And so maybe if a woman is on the big side and she has a lot of estrogen, if she has fibroids, then they tend to grow bigger and quicker compared to people. So we just usually advise people to maintain healthy weight because it has other health benefits compared to when someone is obese or overweight. So basically, those are fibroids, benign tumors of the uterus. So this cartoon is just to explain the relationship between fibroids and fertility. A lot of times patients don't quite understand the fact that fibroids are located in different parts of the womb, and depending on their location and size, they can affect pregnancy or fertility differently. And so a lot of times we're seeing patients that are saying, my friend has fibroid and she's getting pregnant and having her kids no issues. As you can see from this diagram, for instance, it will turn out that the biggest among them is the one that has the least effect on fertility. And that is because it is located outside of the uterine cavity. So this is described as the subserous type of fibroid. It's pedunculated, it's attached with a stalk, so it's just here. When we talk about fertility, this is the area, the cavity of the uterus is the area that we're concerned about. And so fibroids that distort the endometrial cavity like this one, or this one that is sitting right inside the cavity, are the ones that most importantly affect fertility. With this type of fibroid, it's unlikely for this woman, a woman who has this kind of fibroid, to be able to conceive and carry that pregnancy to term. So not only do they make it difficult for conception, they also increase the risk of miscarriage. And so we also see these people are misinformed where they are told, you have a fibroid, but the fibroid is small, and so you don't need to worry. It is just to say that I would use this, just this model to say that this tiny fibroid, for instance, here, would not allow this woman to conceive, and so it will have to be taken out. So we need to move away from telling patients, your fibroid is small, and forget the location. Location somehow seems to be very important, and so this submucous fibroid, which is distorting the lining, as you can see, and this one that is sitting right inside the uterus, is the most significant type of fibroid that will affect fertility. The second type of fibroid that would affect fertility, this is subserous in a way, but as you can see, it is displacing the tube. So if this woman has this type of fibroid, so when women have very large fibroid, then they become what we call transmural. You see that it's pushing out, it's also pushing in. And so it's blocking the tube. So if she has multiple fibroid and there's another one here also blocking this tube, then of course they can also cause infertility. So what this essentially means is that women would need to be evaluated properly, determine the location of their fibroid, the number and type, and then know the ones that are causing symptoms. This fibroid, for instance, can be taken out using what we call a hysteroscope. And so that has revolutionized the intrauterine surgeries, where you can actually remove fibroids and polyps. Polyps are soft growths within the uterine cavity without having to cut the woman open. And so you can come in here with your instrument and just shave them off, and then you are done with the surgery. And so these are also the type of fibroid that also cause heavy menstrual bleeding. And so the woman would need to be evaluated to know what kind of fibroid. If the woman has submucous fibroid, most of the time it's advised that the fibroid is taken care of before the woman can conceive, either naturally or you want to do IVF treatment. So these are the other types of fibroid. This is within the cervix. This is pedunculated. It's growing inside but it's attached with a stalk, and this is in the vagina. This again can interfere with intercourse, because if you have this mass, this is this woman's vagina and this is here, then she may be bleeding after every intercourse. Even penetration might be difficult, and so in that manner it can also interfere with fertility. So, but by and large, these subserous, the ones, if you look from outward inwards, that's how important. So from outside they are least important. As they get closer to the interior, then the relevance to affecting fertility increases in that order. So that's just the point I want to make about fibroid and fertility.